I have many patients on either Ozempic or Mounjaro, and usually when I first prescribe this medicine, I try to review how to use the pen, either using one that we have in the clinic or by looking at videos, but I thought it would be helpful if I made my own video. Here I have the Mounjaro 15 milligrams pen. This is the maximum dose. When you first get this pen from the pharmacist, you want to put it in the fridge as soon as you can, and it's going to stay in the fridge until it's time for your injection. So before your injection, I want you to take this pen and put it on the table at room temperature for about 15 to 30 minutes. This will help get the chill off. The reason why we do this is because specifically Mounjaro or tirzepatide can cause a little injection site reaction. So where you inject, you might notice that you get a little bit of redness, maybe a little bit of a bump, and it could be pretty itchy. And this is kind of normal, specifically with the tirzepatide. So by taking it out a little bit earlier from the fridge and letting it come to a room temperature, this should help prevent this injection site reaction. Now, this little bit of itching, a little bit of redness, that's normal. But if you have a rash across your entire belly or spreading, that's not normal. That could be an allergic reaction. Don't use the medicine if that happens, and let me know. If you do get like a little bit of redness, a little bit of itching, you can use a little bit of hydrocortisone and it should go away. So you've left this pen out, now it's time for your injection. So the first thing you want to do is make sure you have not only your pen, but your needles. So your pharmacist should have given you these. This is of course a brand new pack, so I have to open it. You're going to want to get out one of these needles. And they're going to have a seal. So you take off the seal and you're going to want to take the lid off of your pen, and then you're going to, you see the needle here, that goes into the squishy part on your pen, just fits right in there, and then you twist. So there's a couple caps here, so you can't pinch yourself the way it is. The next step is going to be to get the right amount of medicine loaded. Now, if I turn this dial, you'll see there's no numbers. The only other number aside from 0 is 1. When you get to 1, that is a full dose. So if I were to turn this all the way to 1 and then inject that, that would give me the full 15 milligram dose. Most of the time you are prescribed your exact dose. There are times where you might want to inject less. Say we have instructed you to do a certain number of clicks, then you would not be going to the 1, you would be counting the clicks. So each one of these is a click that you would have to count. So say we said 30 clicks, that would be half of a full injection. If you go to 1, it's 60 clicks on the Mounjaro pens. So you would count to 30, and then once you got to 30, you would stop, because that would be the dose we told you to inject. Or maybe it's not 30, maybe it's 15, but we'll give you the instructions. And that's it, that's loaded. Now you go back to this part and you'll see that there's this first cap, then there's another cap. So I would get it to this stage. Then you're gonna take an alcohol wipe and you're gonna wipe the skin where you want to inject, let that dry. Then you take this cap off and you're gonna take this little needle and you're gonna inject it into the skin there. Now, some people, like in the next video I'm gonna show you, can hold the skin with one hand, hold the pen with the other, and push down with the same hand. That's a bit more skilled, someone who's been doing this for a while. But maybe for your first couple injections, you might wanna hold the pen with one hand and push the plunger with the other hand, just so you ensure that this needle remains in the skin. What I noticed is if you're doing it with one hand, you might end up pulling the needle out by accident from the skin, and you might lose some of the product. Now, remember, there's 2 caps. I have had some patients forget to take off the second cap. The needle's not gonna go through this. So you have to be able to see the actual needle. So you inject. When you're done, put the big cap back on. You're going to unscrew it. Whoops. Sorry, there we go. Once that's off, this can go in the trash, and then you're back to this squishy red dot. Put your cap back on, put this back in the fridge, and you're good until next week. Sometimes you're gonna get to a point where the plunger stops going down, but you know there is still medicine left. So it might stop here, but there's still some medicine. And I think You would have already talked to me about this, but if that happens, we will help you try to pull that out. And I can do another video showing how to do that. Here's a video of an actual injection. So off goes the big lid. You're going to take the seal off the needle. Then you screw it on. Keep turning the pen until you can't turn it any longer. Pull off the big cap. This would be a good time to take an alcohol wipe down the skin where you're going to inject, and then you take off the second cap. He's going to pinch the skin with one hand and inject with the other. But like I said, if you're new to this, you might want to hold the pen with one hand and inject with the other hand. He's going to start pushing down the plunger. You see that it's starting to turn. He's slowly injecting the medicine. Keep on pushing until it stops going down. You're going to hit 0. That's when you pull it out, put a lid on the needle, and throw it in the trash.